This is the 23rd edition of the National Congress of Psychiatry of the Mexican Psychiatric Association and also the Regional Congress of the World Psychiatric Association. So today we have the participation of Dr. Dinesh Bhugra. He comes from London, United Kingdom, and he's the president-elect of the World Psychiatry Association. Doctor, how are you today?
Very well, thank you very much. Thank you for inviting me.
Which is the importance of psychiatry at this moment of the world?
I think we're going through a very interesting time because certainly in the first 13 years of this century, there have been lots of changes which nobody could have predicted at the beginning of last century. For example, globalization has meant that lots of people are migrating from one place to another. Lots of people are moving around, professionals are moving around. People's way of thinking is changing and moving. And that means that people are looking at mental illness and the causes of mental illness in very different ways. In addition, in the last 15-20 years, there has been a major change in our understanding of the brain and neurocircuits, and therefore with Genome Project and with understanding of brain, it's become really fascinating that we're looking at psychopharmacogenomics, which basically means is that we will all be carrying our genome map on a little pod, and if you have certain symptoms, you put it in the computer and it might tell you what medication you need. Having said that, I think we still need a psychiatrist because it's an absolutely critical link between the patient and the doctor, because patients like talking to human beings rather than machines. There are quite a few other changes happening in the 21st century. Societies are changing, there's more urbanization, and certainly I was looking at some data which indicates that it took New York about 150 years to get its million level population, whereas Mexico City has been less than 50 years. So the rapid change of urbanization means that people are looking at life in different ways. Social support systems are beginning to change, families are being left behind, people are moving into town. So there's a whole range of changes, which means that we're at a very exciting time in psychiatry.
Doctor, and at this moment of the world history, can we say that is there any population that is most vulnerable than others with mental illnesses?
I think all of us are vulnerable. That's the first thing to say. It just depends upon the circumstances and depends upon the trigger point. Women are much more vulnerable, elderly are much more vulnerable, children are much more vulnerable, migrants are much more vulnerable, lesbian, gay, transgender, bisexual individuals are more vulnerable. So you can't just say that one group is more than others. Everybody is equally vulnerable.
Doctor, and today we have better medications and better opportunities for the people who has mental illnesses.
I think certainly there are better medications, but the tragedy is that in the last few years, many pharmaceutical companies have announced that they're not going to research psychiatric medication. So we don't know what happens next, because that for any drug to be marketed, we're talking about 15-20 years run in. And also, as I said earlier, that with genomes and genomic mapping, I think it's absolutely critical that we get much more personalized, much more focused interventions. For example, a few years ago, Federal Drug Agency in America approved an antihypertensive drug which was marketed only for African Americans and African Caribbeans. So obviously, there will come a time when the medication will be much more person-specific than it is.
Okay. Doctor, and for closing our interview, would you like to send a message for all the physicians that are watching us, most of them primary contact physicians?
I think the major message for everyone is that mind and body go hand in hand. Mind affects the body, body affects the mind. So mental health is part of physical health, and we should not have that separate. And They should be integrated in our assessment and in our management. And every patient you see, ask them about their mental health as well as their physical health.
Doctor, thank you so much for this interview.
Thank you.